Hello, everyone. My name is Naama. I am an ophthalmologist by training, and at Google, I work on a team that applies deep learning to medical data. Today, I'd like to quickly walk you through our work around diabetic retinopathy and specifically around diabetic retinopathy screening and how introducing deep learning models into that process can improve outcomes and prevent blindness. So, the first step is training the model. And the question is, why even? And as I'm sure everybody knows, almost 500 million people around the world have diabetes. And all these patients are at risk for diabetic retinopathy, which is the leading cause of blindness worldwide. All these people need an annual checkup by an eye care specialist to see whether there are signs of disease in their eyes. But clearly, there aren't enough eye doctors in the world to look at all the people on an annual basis. So what our team did a few years ago was think maybe we can train a computer, maybe we can train AI to look at photos of the back of the eye, which is what an ophthalmologist would do, look at the back of the eye, and tell whether there are signs of disease in that photo. And that way, help automate the process and take the load off of doctors and bring this to the world to people who actually don't have access. That model actually turned out to be very, very accurate, and it was on par with the ophthalmologists that help with this, general ophthalmologists. So very, very accurate. In fact, with further tuning and some additional work, the model is actually now on par with retina specialists, who are the gold standard for detecting and diagnosing diabetic retinopathy. So we have a very accurate model that performs at the level of an eye specialist. Have we prevented blindness? So the next question is to ask, well, how does it work in the wild, in the real world? And for that, we launched quite a few deployment research studies, bringing the model into the clinic, into the screening process, and seeing how it integrates and how it affects all the people involved. And what this actually means is looking deeply into the screening process, mapping each and every person in the process and how introducing this model actually affects them and how the process or the workflow could be improved with the deep learning inside. So this is a human-centered approach, and that is key to building and bringing this into the world and making impact. So the next step, basically, with all these learnings, is to redesign the workflow and, again, see whether it actually brings impact to patients and improves screening and diagnosis. And for that, we launched a study where we wanted to compare what happens when patients who come for screening get the answer of the screening on the spot. So currently, the existing workflow is that you get your photo taken. This is a primary care setting. You get your photo taken, a person reads it within 2 weeks, and then your clinic gets the result. And then, if needed, they schedule an eye exam for you. And this takes months and months. And what we wanted to see was whether the fact that we give the answer on the spot actually improves people going and seeing the eye care specialist. So giving the results, sharing the results on the same day of the clinic visit, and scheduling an eye exam actually improved adherence for patients with referable conditions who are urgently needed to be seen by an eye specialist, from 35% to 72%. So significant improvement in adherence to follow-up. And the next step, obviously, is to see whether this, what are the rates of visual impairment in those patients and whether these were improved. Unfortunately, COVID hit, and we couldn't run that study yet. So I want to thank you very much for listening, and I hope you all have a very productive discussion, and hopefully we prevent blindness in the world. Thank you.